Welcome to Motherhood Aligned and Assigned, where we help guide mothers from symptoms to solutions.
We're Dr. Serena Coffman and Dr. Veronica Schiltz, nervous system specialists helping families discover the missing link in their wellness journey.
Join us as we translate complex health challenges into simple, actionable solutions for you and your children.
Because your family deserves to thrive,
not just survive.
So hopefully, I don't know that we've actually really talked about this a lot, but in our office, we talk about poop a lot. Like,
yes.
You just have to get used to how often are you going? What's it like? You know, that kind of thing. So this is what this episode is going to be about. It's important because typically when we get patients, and we were actually just talking before this, some get more patients than others who are on Miralax all the time. But maybe you are either a new parent or sometimes you're even an adult, right? And you're looking to your primary medical doctor to figure out why you're so constipated, why you're not going regularly, maybe why you've never gone, maybe why your child has never gone. And so either your primary or pediatrician prescribes Miralax for your child's constipation and told you it was safe. However, you don't realize that the constipation your child is experiencing is also the culprit as to why they're having meltdowns and anxiety and mood swings and behaviors. Those things are always kind of going in the background and you just kind of think that they're normal, but you don't realize that they're correlated together. And so when you get to this point where your child and you're realizing, I don't know when the last time they went to the bathroom, right? Maybe you have a toddler, they're not pooping in their diapers very often, or maybe you have an, 3 or 4-year-old, maybe they're not going in their diapers anymore, but you're still like, I can't remember the last time they actually went to the bathroom. So if you are on this podcast, you are going to realize that they are connected. But I do want to mostly talk about today the use of Miralax and how it actually isn't the best thing to go for, especially when you are a parent trying to help your child out. And so we're just going to kind of share a fact with you in that most parents don't know this, so it's kind of like an informed consent moment, but Miralax is actually not FDA approved for children under 17. Its pediatric use is official off-label, and over the years, the FDA has received reports of neuropsychiatric side effects in children, including anxiety, aggression, paranoia, and obsessive compulsive behaviors, which is very interesting because you are already experiencing that most of the time if your child is not going regularly. So you might not even notice these things, but there actually is a correlation between more of those mental health issues happening with Miralax, probably because they're the same things that are, cycling into that dysfunction that is causing the constipation in the first place, right? You're just kind of throwing something at your child's nervous system that it doesn't even know what to do with, right? So it's just going to get more and more aggravated, and you're going to see more things like behavior and anxiety and things by using it. So today we're going to unpack what's really going on, why constipation may not be just a digestive issue at all, and spoiler alert, we are going to talk about the nervous system.
So this episode's for parents whose children are currently taking Miralax or other laxatives for chronic constipation, parents who've noticed behavioral changes and mood swings and worsening anxiety after years of starting this medication, and families who are frustrated that constipation keeps coming back despite increased doses. And then if you're searching for a drug-free root cause answer. And I'm going to add in this category of people who I see a lot in my little crunchy community over here in Boise is those of us who are like, yeah, I'm going to pop over to Vervain and get the Smooth Move tea, or I'm going to try aloe vera, or all of these other, like these tinctures and things to get stuff moving. It's like, so I always like to ask, what's going on that we have to get additional aids to help us poop, right? Because you're designed to poop regularly. We got to get that stuff out. Mm-hmm. So if that's you, you are in the right place. So Dr. Veronica, do you want to share a couple little stories of some kiddos that you've seen in your office who have needed some extra help?
Yeah, I always like to share the most intense one because as we've kind of chatted about before, and I think I've even mentioned him in a couple of other episodes, he was having some blood sugar issues and they could not figure out what the heck was going on. He was seeing a specialist after specialist. He went to Omaha and then he went to Texas and we're in Iowa, so that he was kind of going all over. And actually it was through that journey that we found out that he also hadn't been pooping. And since a child, he had these phases that he would go through where his parents would put him on a pretty high dose of Miralax multiple times a day to try and clear out his system because he just simply never went to the bathroom, even from an infant. And so we got to the bottom of that. And I was like, we can work on that. And I always think it's so interesting because in this episode, we are talking about how Miralax can affect behavior. We know that to be true, but I often see that behavior was already kind of a thing anyways. It's just that parents don't really, there's this like blurry line of like what's acceptable, what's developmental, and what is not. Right. So they often don't bring that up at all until we get to, get to the bottom of it. And they might notice an increase in those things, but they also kind of blame it on, well, he hasn't gone to the bathroom, right? So it's like there's this like cycle that keeps happening where the child is not pooping, and then they're kind of irritated either before, during, or after that process, and then they take Miralax, and then that whole cycle repeats where they're still not going to the bathroom, they're still more agitated, and it kind of keeps fluctuating. So yes, for Spencer's case in particular, he came in for this blood sugar stuff, and we found out through, his care plan and unwinding the stress in his nervous system that constipation is the first sign that other dysautonomia is going to take place, right? So it's like anytime he's in a growth spurt or anytime he is in a stressful situation, constipation is the first thing that shows up. And if they don't bring him in soon enough, then we start to see behavior issues. And then we start to see blood sugar spikes with him. And so not everyone's going to have that same cycle, right? But that's how he expresses stress. And so anytime he comes in, he's able to get adjusted. He's able to go to the bathroom. And then that kind of storm no longer needs to continue because the body has found regulation. It's found adaptability, and it doesn't need to go through that, right? And so while Spencer's case is a little bit unique, I still have other cases that come in where it's like, we just every now and then we'll give them a Miralax, or we'll do the gassy, right, to make their whatever that thing is to get them to start pooping. It's like parents have all these tips and tricks and ways to get things moving. But the point of this episode is you're just kind of covering up the problem. And I don't want any more adults to come into this office. I mean, there's going to be, but my goal with this podcast and with the work that we do is that we don't want adults coming into the office that we've had where they're still taking Miralax since they've been kids and they've never had a regular bowel movement in their entire lives. And now they're having other issues because of it, right? Because our, pooping is a main detoxification center, right? So that is the purpose of this. We're just going to dive into the deeper causes of a constipation because they're not talked about enough.
Yeah. So if Miralax isn't FDA approved for kids under 17, right, it's off-label for pediatric use. Why is it prescribed, right? Because some common digestive side effects even that aren't the crazy things like the anxiety, aggression, mood swings, paranoia, OCD, just regular ones are bloating, cramping, gas, diarrhea, and in some cases, electrolyte imbalances or bleeding, which is crazy. And traditional medicine is viewing constipation as a symptom to manage. I see that a lot. This is just how it is. Here's how you manage it. So when side effects show up again, it's like, well, let's just manage it more. We're going to give you higher doses, or we're going to add another medication. And the root cause is remaining untouched and not adjusted. And so how does Miralax work? So Miralax works through osmosis, right? It's pulling water into the intestines to soften the stool, and it forces movement. But here's what it's not doing. It's not restoring your child's natural digestive coordination, right? Because our digestive system, our intestines, are all smooth muscle that require a brain to organ, a brain to muscle connection and coordination. Just like coordination is needed for sitting and rolling, crawling, those kinds of things that are super visible. And when we don't meet those milestones, we're like, hey, that's a thing. How about pooping is a milestone? Like pooping every day is a milestone. Mm-hmm. So simply put, digestion is controlled by the nervous system, and specifically the balance between fight or flight and rest and digest. And if we are thinking of our nervous system as our air traffic controller, it's coordinating swallowing, enzyme release in our stomach for acid release to break down food, enzyme release in our small intestine, motility, elimination, all of those things. And using a laxative without addressing the nervous system imbalance is like pushing on the gas pedal while your parking brake is on, right? So you might move, but you're still stressing out the system to get motion going. And research is consistently showing us that disrupting this natural gut process and This includes the use of antibiotics under the age of 2, by the way, because I consistently see that disrupting our digestive systems. These are just associated with the increased risk of allergies and asthma and chronic gut dysfunction later on, which, by the way, we just talked about in our previous episode of how the immune system is very tightly correlated and connected with the gut and the vagus nerve. So check that out if you want more information on that.
Yeah, and I think it's just important to note too, like even just like bringing in antibiotics under the age of 2, right? It's like you don't realize as you're going through it that all these things are popping up. So it's like, the colic, the constipation, the fussiness, the tension. That seems like one category and one issue. And then you've got, oh my gosh, they're sick all of the time. That seems like a different issue. But then it's like, oh my gosh, now they're more constipated. It's like the times they were going, it's going even less. Now I need Miralax, right? So it just kind of shows how something, even as we were reading this off, we're like, antibiotics seems random here, but it's not, because it's like antibiotics before 2, creating more of that dysfunction. And now we need either Miralax or something to get the system going. Or maybe you didn't do antibiotics, but still needing that Miralax to push that water in, get things moving. The body is keeping score of all of that. And we want to make sure that we're addressing things before we continue. Because, yeah, we talk about kids a lot, but then we also need to go into the fact that, anxiety meds and depressive meds are being prescribed younger and younger and younger. And all of that kind of goes from the use of, getting sick all the time, needing antibiotics, needing Miralax, and so on and so forth. So I don't know. I don't know if that was random or if that was helpful to anyone, but it just kind of shows how all of it is correlated together and tied together. And so, yes, this is an episode about constipation, but truly, constipation can impact all of your life for a very long time if we're not getting to the root causes to the dysfunction that's causing that constipation.
Yeah.
So I thought I would just head us into the perfect storm, why constipation started long before you noticed. We talk about this probably at least once an episode, but constipation doesn't show up, right? It's not just like this weird thing that happens. It begins with the perfect storm where we've got the prenatal stress, then the birth interventions or birth in general, depending on, that situation, the environmental toxins, antibiotics. So we've got the 3 T's, the toxic stress, chemical environment stress, the emotional stress of being a human, and then the physical stress of being born and growing up and all those kinds of things. And so these stressors stack on top of each other like building blocks. And the result is you're stuck in this sympathetic dominance, which is basically just like saying, we use that analogy, not pushing that gas pedal on a parked car. You are able to move a little bit, but you're spinning your wheels and you're exhausted all the time. And so when your child's nervous system becomes stuck in survival mode, that's when digestion can take a back seat, because it's like, we don't need you. We're going to work on other things to survive, right? It's one of the first functions that's going to shut down in stress mode. That was the case for Spencer and a lot of other kids that we see in our office. And then a child that is stuck in chronic fight or flight cannot fully activate rest and digest, right? Because I always use this analogy all the time. If you see a bear heading towards you, you're not going to be like, I wonder what's for dinner, right? You're going to use all of the other things in your body to protect yourself in that moment. And so imagine living in that state of always looking for the bear. You're not going to be hungry. You're not going to have the best appetite, but you're also not going to digest the food that you are eating.
Yeah. So if Miralax or prune juice or anything else isn't the solution, and we're talking nervous system, what's the neurological path forward? And this is where neurologically focused, asterisk important, pediatric chiropractic care comes in. So instead of forcing the bowels to release, we assess and restore the nervous system regulation. So we activate the brake pedal. We increase vagal tone by removing stress from the vagus nerve to help restore nervous system regulation, right? And what is beautiful about this style of practice is that most of us are using something called insight scans. It helps you tell the story, right? Because it's going to show us if they are, in fact, in fight or flight with a heart rate variability test. That's giving us an idea of their adaptability to stress and how long they've likely been stressed. Thermal imaging, that's showing us deep-rooted stress patterns. And EMG, which is a fancy way of saying neurological neuromuscular tension, which is a fancy way of saying where is your body tight and where is it not strong enough to hold up and support your system. So these scans are showing us all your story and how adaptable you are, and if your nervous system is turned on in the right places to help with digestion. I don't know about you, Dr. Veronica, but when I see constipation in a story, I often see really turned down thermography scans, like past like T12 and down. Like it's, and what I'm saying there, for those of you listening who are like, what the heck are they talking about? The temperature scans are helpful because our nervous system is responsible for regulating the skin's surface temperature. And if it's showing up as really cooled down in any area, we can assume that that part of the nervous system in that segment is really fatigued and tired and is just like given up. Right, it threw the parking brake on and it's like, see you later. And we often see that in the lower back area with constipation and immune system stuff and allergies, because the gut is all related in there.
All of those things.
All of those things. And so what we get to do is apply gentle and specific adjustments to restore life and vitality to those sluggish areas like we were just talking about, and reduce stress and tension on the areas that are noisy and sticky in your nervous system. And what's the thing that most often improves first? Sleep. And then, what do you see, Dr. Veronica? Second.
I actually would say sometimes I see digestion improve first.
Oh, interesting.
Sleep and digestion kind of compete for me.
Yeah.
And I don't know if it's just because I see a lot of patients who come in for sleep issues, and it's like, I feel like this should have happened a little while ago.
Yeah.
But I feel like sleep for us takes forever, but digestion always turns on. So it can be
nice.
It can be both. And I think it's interesting that I think one, like, I don't know, I'm guessing if someone comes in for constipation for you, their sleep probably gets better.
Mm-hmm.
Most people are coming in for sleep for me, and then we find out that they're constipated, and so their constipation goes away first, and then they start to sleep.
Yeah. So the biggest issue usually is the last to really get knocked out. Yeah.
Yep.
So all to say, the thing you came in for is not the first thing to go.
Right.
Sometimes.
Yeah.
But
things are improving along the way.
Rest.
That's what you should see.
Yeah. Rest and or digest are coming online first,
In some way,
which is really exciting to see.
Yeah.
What came on first in, what's his name?
Spencer. Gosh, that was like a while ago now. I want to say it was his digestion came on first.
Nice.
And behavioral was like the last thing to go.
Right. In our hierarchy of healing.
Mm-hmm. Right.
So.
Yeah. Because I was trying to think, I don't think he was ever really a bad sleeper. He was like a drunken bull, so his sleep was fine when he came in. It was just that he was pretty constipated, and then he had other issues.
Yeah.
Yeah.
So, Dr. Veronica was able to set the foundation for his nervous system, and everything improved on top of that, which is so exciting.
Okay, so your child's constipation isn't just a digestive issue if you haven't gotten that by now. It's often a neurological one. So Miralax may provide temporary relief, but it does not restore the nervous system regulation, and it comes with side effects that deserves careful consideration. So we're never trying to tell you what not to do, what to do, all the things, especially if your pediatrician recommended it. Just know what you are agreeing to before you start that journey, okay? So you're not crazy for asking questions and thinking, isn't there another way? You are not wrong for wanting deeper answers. You may simply be addressing symptoms before repairing the foundation. And when nervous system function is restored, digestion can finally work the way it was designed to. So if your child is struggling with chronic constipation or has experienced behavioral changes on medication or laxatives, we encourage you to explore drug-free alternatives where you get to get your kid back and have them go to the bathroom regularly, which is exciting. So check out the show notes below. Send us a DM or schedule directly with Dr. Veronica or Dr. Me or Serena. I cannot speak. You guys know the drill. You know what to do. Check out the show notes for PX Docs directory for a doc near you. Your family deserves hope, and your child deserves healing from the inside out.
Amen. I'll praise out. Dear Lord, thank you for poop. Truly, we have so many moms in this office that are just so thankful when their child gets to eliminate and their nervous systems start to heal from the inside out. Thank you for that opportunity to provide hope and drug-free answers to these families. It is an honor and a blessing. In your name I pray, amen.
Amen.
Thank you for joining us on Motherhood Aligned and Assigned.
We hope today's episode helped you connect the dots in your family's health journey.
Remember, this is where nervous system health meets motherhood wisdom.
Until next time, we're Dr. Veronica Schiltz.
And Dr. Serena Coffman, supporting you as you nurture your family's well-being.
Because when you're aligned, everyone thrives.